is your question. You'll be given 1 minute to read this. After 1 minute, I'll be asking you a question. Right, so if you have read and understood, considering its surgical and optimization, kindly please tell me if you can identify what region are you looking at?
It's anatomy. It's anatomy of the hip. It's anatomy of the hip,
Gluteal
posterior
region.
view,
Gluteal
and the
region, not a
gluteal
hip.
region.
Yes. Okay. Can you please tell
Gluteal
me
region.
if you can identify you can see two sets of muscles as you could see in this image, superficial and deep. Now moving on to
Yes, I can identify.
superficial muscles, group of muscles. Can you please identify what is this big muscle?
This is gluteus major muscle.
Okay. Can you please identify which one did you say?
This one.
Yes, which muscle is this?
Uh, gluteus medius muscle.
Okay, can you please identify this one? Here.
Iliacus. Iliacus.
No. Would you be able to tell me the origin and insertion of this muscle? If not, then please tell me
Um,
the nerve supply.
which muscle?
Yes, this one, please.
Madam, I have not revised this section.
It's all right. Okay, can
I
you,
have not revised it.
all right, we can do it together. Can anyone else help you? Or can you name the muscles of the gluteal region as a whole? You could.
Yes, ma'am. Gluteus maximus, gluteus medius, gluteus minimus.
Okay, this is gluteus
Gluteus maximus.
maximus. This is gluteus maximus. You were right before, but you were not sure. So this is gluteus
Okay.
medius, right? And
Okay.
then,
Gluteus medius.
yes, and then if you'll ask me on the other side, this one is gluteus minimus.
Okay.
It's one of the deepest muscle. And then this is piriformis.
Piriformis.
This,
Okay.
this is obturator internus. And
Internus.
this
Okay.
is obturator externus. And
Externus.
this is gemellus inferior, and then quadratus femoris here,
Quadratus femoris. Okay.
right? So you
Yeah.
are supposed to be knowing their origin, insertion, and their innervation and their mode of action. Would you be able to
Okay.
tell me the origin and insertion of quadratus femoris muscle? It's here.
Ma'am, I have no, ma'am.
Okay.
I have not revised this
All
part of the
right.
anatomy. I just revised
Okay.
femoral
I
trachea
thought you said
and
you've
that part.
read so. All right, we'll move on.
Yeah.
We'll do that again. We'll move on. All right. Can you
Yes, ma'am.
identify the bone that you're seeing in front of you?
Yes, ma'am. It is femur.
Yes. Would you be able to identify of which side? Femur bone?
Left side.
Yes.
Left
Okay.
side.
We'll see. All right. Can you please identify the structures? Number 3 in picture A.
Uh, acetabulum.
Can you identify number 2, please?
Greater trochanter.
Uh, and if you can identify, wait, this one, 6.
Neck of femur.
Okay, can you identify number 4, please?
Intertrochanteric ridge.
Okay, number 9. Shaft.
It's the line.
It's the shaft. 9 is shaft.
Shaft. Okay, shaft.
All right, 11, please.
Trochanteric fossa.
5, please.
Lesser trochanter.
What does it insert here? What's the attachment? Would you be able to identify? Okay, we'll move on. We're moving on. We'll discuss this at the end. Right. If you can identify number 2 over here, please, in picture A on the right-hand side.
No, ma'am.
Can you please tell me what are the factors which stabilizes the hip joint?
No, ma'am.
Okay,
I can't recall.
Okay, can you tell me how hip joint is formed? It's very easy. Think and tell me, please.
Ma'am, 3 bones.
Okay.
It's a ball and socket.
Ball and
3 bones
socket
form
type of synovial joint. Yes, very good.
3 bones form the ball.
Yes.
Ilium, scapula, and pubis.
Okay. And
All three contribute. All three contribute to the formation of ball, and there is the capsule and
yes,
3 ligaments,
yes, and
which provide stability.
okay, and acetabular labrum. Yes.
Acetabular labrum.
Yes. All
Acetabular
right.
labrum.
Right. Okay, we'll move on. Can you please identify, would you be able to identify what kind of image is this?
It shows femoral artery.
Yes, but what does this type of image called?
Angiography.
Okay, angiogram of the
Angiogram.
femoral, yes, artery. Can you tell me if you can identify number 2? Or number 2 you've already done. Okay, number 1 is catheter and number 2 is femoral. Okay, if you can identify number 3 and 4, maybe, or 6 and 7.
7 is profunda femoris.
Okay.
So 3 is circumflex femoral.
All right. Can you tell me,
And
or can
4
you
should
give
be
me
obturator.
some
Obturator artery.
indications in which condition would you ask for this sort of imaging?
In suspected embolus
And
or
yes,
obstruction.
yes,
Embolism or obstruction.
or ischemia, yes, good.
Or
Can you,
ischemia.
would you be able to identify this image, please? This is
also CT angiogram.
Yes. So what are the bones? What are the structures which are marked? If you can identify this one.
This is
Popliteal
at
artery.
this point it is femoral artery. Popliteal artery.
Yes. And which one is this one? Which one is this one? Tibio peroneal trunk. Okay. If you can identify this one.
Peroneal trunk, right.
Anterior.
Anterior tibial artery.
Yes, where is my, and then this one. Peroneal.
Peroneal artery.
Posterior.
Posterior tibial artery.
Yes. So these are it. Right. Again, it's the same question. In which situations or conditions would you ask for this imaging?
In suspected ischemia.
Yes.
Or embolism or suspected ischemia.
Yes. Good. So these are the basic simple questions. That was it. Bell has already gone. I'm sure you could hear the bell. It will be
Yes,
louder for your exam.